Joining us now is our first special guest. I'm joined by Dr. Shailaja Teacher, the Health Minister who's been lauded across the world for her efforts in COVID-19. Thank you very much, ma'am, for joining us. Some things seem to have changed. A few months ago, everybody was looking to the Kerala model. Now, when you look at it, more than 92,000 active cases, third largest caseload of active cases in the country after Maharashtra and Karnataka. How do you respond? Do you believe something has gone wrong?
We cannot say so because this is what we expected earlier, and we give the warning to the society, the people also. As you said, this is the Kerala have one of the longest drawn epidemics because the epidemic started in Kerala just after Wuhan incident, that is in January 30th. And 1 month after the epidemic go to other states of India. And we can divide it into two parts. The first phase from January to March 24, we got 499 cases, and out of which we have 33% local transmission and 3 deaths. The case fatality rate at that time is 0.5%. And when the lockdown declared on March 24th, we got some time to improve our health system resilience, and we worked hard. And up to May 3rd, there was no other cases, and we are in a comfortable zone. And the whole world looked at us and asked what is the method you used to contain this virus or to flatten the graph, and we explained what we are doing here. We are applying a scientific strategy to slow down the graph and to save lives, to reduce the mortality, case fatality rate. But after May 4th, it changed, and the lockdown lifted. The people from outside, from other countries and also from other part of India started coming back to Kerala. We have the large number of expatriates, as you all know. After May 3rd, 9 lakhs of people returned to Kerala from abroad and also from other states of India.
No, but ma'am, that is true, ma'am, with due regard, ma'am. With due regard, that is true of other parts of the country as well. Kerala is not the only state which got people coming in from different parts, whether it was migrants, whether in your case a lot of those who were living in the Gulf came back to Kerala. The fact though is that of the recorded 2.53 confirmed cases at the moment, 21,000 are linked either to international or interstate travel history. So a lot of the cases have risen within Kerala. Why have so many cases risen within the state?
Yes. Right. What you are saying is right. Because of the lifting of the lockdown, we should also have to announce some in the lockdown, and because of that we can start some work and other thing, and offices opened. But at that time we want that people should not gather. People should not be in groups, and gathering should be avoided and should keep 2-meter distance. And we started the break the chain campaign, that keeping social distance and also wearing masks, etc. But during that Onam season, some people didn't obey that, and there are some mass gatherings because of Onam celebration.
No, so did you open? No, that's exactly. Sorry again to intervene. Did you open too early, ma'am? Sorry to intervene. Did you open up too early? Kerala tried to open up restaurants, tried to open up the state much earlier than many other parts of the country. Did you open up too early?
No, too early, because after central government declared the lifting of the lockdown, we should also have to do that, because we should have to protect lives and livelihood at the same time. But because of our vigorous campaign and because of our break the chain campaign and other strategy of testing, and that is why we can protect more lives this time also. The case goes to 2,58,850, but 1,67,256 recovered, and we have 90,000 live cases, but our case fatality rate is below 1%, that is 0.36%. I think it is shortest, or this is the good rate. We can say throughout the world it is above 1%, and case fatality rate 0.36% is a good sign.
No, I know that your mortality rate is low.
And good practice.
No, I take the point that your mortality remains relatively low, and that's a positive. But one final question: what about testing? According to reports, some reports, you're actually not testing as aggressively as you were a few months ago. Is that true, that compared to other parts of the country, Kerala also now seems to have lost that vigor when it comes to testing? Is there a sense of fatigue that has set in? Are you all tired after this long several months of battling corona?
No. We are applying a scientific testing strategy from the beginning itself, and we are following now also. In the first part, we applied that strategy, that trace, quarantine, test, isolate and treat. I think that is a scientific thing. We are approaching this virus, this spreading, this pandemic in a scientific way. Not test, nothing else. But we are testing properly, and we gradually increased the number of testing also. Now we are testing more than 60,000 or 70,000 of samples per day, and that is a good number. And except from testing, we are adopting the proper method of isolating and quarantine, etc. We are giving proper treatment. We arranged more than 1 lakh beds to treat these people. And we have COVID first line treatment centers and COVID
I take that, but your test positivity rate, ma'am, your test positivity rate, your positivity moving rate, your increased recoveries compared to the rest of the country, you're moving in the wrong direction. Is there a worry? At the moment, are you worried, or is the situation fully under control?
No, we can say that we are enthusiastic. The situation is under control. But the test positivity rate increased because of this mingling or gathering of people after Onam, and also the protest rallies of the of some opposition, and also some gathering for some marriage, etc. The test positivity rate increased in the clusters, we can say so. And but we are keeping it below our health system resilience. We improved our health system resilience, and no one is laying behind without getting some treatment. Every people who were tested positive were admitted to the hospital, and we are giving proper treatment. 50%, only 50% of our bed is occupied in our COVID hospitals, and below 50%. And above 50% of beds are vacant, and ICU units are vacant, and ventilators are vacant. That means that we can provide good treatment to people who were getting positive afterwards also. And we are enthusiastic on that. Everyone is getting proper treatment. That is why we can reduce our case fatality rate.
Okay, well, that's reassuring to hear at a time when Kerala is once again under the scanner, this time for the wrong reasons. Shailaja Teacher, Health Minister of Kerala, appreciate your joining me and speaking to me on the News Unlocked.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.